Hi, I wanted to talk about an unusual case I saw today that brings up a question of the potential role for systemic or whole body therapy in treating brain metastases, in this case in someone with a metastatic lung cancer. Traditionally, the mainstay of treatment for brain metastases, especially in someone who has multiple brain metastases, has been whole brain radiation. And the concept is pretty simple. In someone who has particularly symptomatic and multiple brain metastases, giving brain radiation for 2 to 4 weeks, typically on a Monday to Friday schedule, has a high probability of shrinking the brain lesions and improving symptoms, and it's associated with an improvement in survival. And that's usually the highest priority thing that we do in somebody who has symptomatic brain metastases at the time that someone is diagnosed with a new cancer. However, there is some hesitation, particularly in many patients and by some doctors as well, for giving whole brain radiation, primarily because of risk of cognitive issues down the line. That tends to be more of an issue in patients who are living for a year or several years after they're treated, and unfortunately that has not been the kind of problem that we have seen very much with lung cancer, where survival has tended to be shorter than that. However, nowadays we are seeing more and more patients, even those with brain metastases, who are living not just for months but for years potentially after their diagnosis and the start of their treatment for advanced lung cancer, including with brain metastases. And if there's any population of patients who that's especially common in, it's the patients who have a driver mutation, something like an EGFR mutation or an ALK rearrangement. And those are the patients for whom we can give a targeted oral therapy that has a high probability of not only working, but working for a long time, of approaching or more than a year, sometimes several years. Importantly as well, at least with the EGFR inhibitors, drugs like Tarceva, which is known as erlotinib as well, or Iressa outside of the US, which is known as gefitinib as well. These are agents that have been known to have good effects of shrinking brain metastases in addition to treating the disease outside of the brain. So the particular patient I saw today is a never smoker just diagnosed with a new lung adenocarcinoma, and the pulmonologist who got the tissue diagnosis from a bronchoscopy also immediately sent that tissue for molecular testing, and she was found to have an activating EGFR mutation. So when I sat down with her today, I was able to talk with her about her having a high probability of responding well on Tarceva, the oral EGFR inhibitor. She actually had presented with symptomatic brain metastases, and she has several relatively small ones, and they don't appear to be causing a lot of problems in her brain in terms of swelling issues, which is a real potential concern. Because of her high probability of responding, I had suggested that we might want to hold off on doing the brain radiation and could instead see about giving her a trial of the Tarceva, and if she responds well to that, which we can assess by her neurologic symptoms, in this case weakness in one of her arms, that we can hold off on the whole brain radiation. On the other hand, if anything seems to be getting worse based on her symptoms or repeat imaging, which I would like to do in the near future, we've got the brain radiation ready to go in short order. So I think it is important that if we're going to consider postponing or not doing the brain radiation at all, because we're hopeful that the systemic therapy is going to do the job for the brain metastases, we need to be able to implement the brain radiation quickly as a next plan if things don't work out as well as we'd like. Anyway, we're just going to start that. We'll see how well that works, and I'll let people know. But the hope here is that we can avoid the potential side effects of the brain radiation in patients who we have a realistic reason to be hopeful might do well for a long time. So take care, some interesting food for thought, and perhaps we will start to become more comfortable with giving systemic whole body therapies as a treatment for brain metastases and holding off on the brain radiation if we get some good experience with this, particularly with our targeted therapies. Take care.